Doing both on Instagram and YouTube. A bit delay for 3 minutes. Maybe it was a net connection problem. So let us start the session. And the first thing which basically we all have to understand, the remedies for fever. Now you will get a lot of cases where there will be a lot of fever, and there will be a lot of remedies that will be confused what to give and what not to give. So in this case, whatever I have seen in my practice, I'll just share. Hello, Dr. Ancha. What I'll share something which I have seen in my practice, and will feel guide you somehow in basically understanding how to give the medicines in fever, especially in cases where there are mixed symptoms and you feel difficult to differentiate. The first remedy, of course, everybody wants to understand and know is about rustox. And it is said that whenever a person gets wet in the rain or elements from getting wet, it is rustox. But there are other remedies also which are very very important for fever cases. For fever it is important. So as you go and look at the therapeutics of fever, there are so many remedies for any season. Like you have, as I told you yesterday, also we have allium cepa, we have rustox, we have bryonia, we have arsenic, lots of remedies. But in case of fever, good afternoon, Dr. Weber, Dr. Meera, Dr. Vishaka, Dr. Borkar. In case of fever, it is very important to understand the role of remedies, maybe not in detail, but some symptoms which basically have to correspond to that fever therapeutics. So first, let us see a very important remedy. Sometimes the remedy is not used as it has to be used. Let us see something about Dalkamara. Now, whenever you have to prescribe Dalkamara, there is it is very important. Hello, Dr. Bailey is there on the Instagram. There is a very important symptom of Dalkamara, that is chilliness with thirst. The patient of Dalkamara has chilliness with thirst, of course, elements from getting wet in the rain or damp weather. You can prescribe, but these are the symptoms which I have seen in my practice. Chilliness with thirst and dry heat and burning of the skin. Dry heat and burning on the skin, especially a Dalkamara patient will have chilliness towards the evening, and mostly a Dalkamara patient will have chilliness in the back. Back. You ask the patient कि आपको ठंड शुरू कहाँ होती है, तो he will tell you sometimes from the neck, from the head, from the chest, from the arms. But a Dalkamara patient would always tell you that the chilliness will mostly start from the back. And of course, then you have typical Dalkamara symptoms which are there in our mathematica, like catarrhal rheumatism, and there's a lot of bulgum, there's a lot of cough, and the Dalkamara patient has a lot of cough when the expectoration, as I told you yesterday, last time also, is yellowish, and aggression from change of weather or sudden change of weather, aggression from rainy weather. These are all symptoms of Dalkamara. But the typicality of the fever is so important. That's why I wanted to share something about Dalkamara. Of course, rustox, and I'll share that about rustox also. But this is something about Dalkamara. Next, when you go to the go to a mathematica, very important remedy, as everybody knows that the remedy is arsenic album. And arsenic album basically has a very typical feature of fever. Now, in arsenic alb, if you want to prescribe arsenic alb, we think about the restlessness, we think about the chilliness, we think about the thirst. It is there. But do think arsenic also in cases where there is lot of weakness. Whenever the patient complains of fever, ask what is the most important presenting symptoms of the patient. For instance, some patient will come and tell you, Doctor Sahab, I am feeling very weak since yesterday and I have a lot of fever, or I have no fever but there is little fever and there is a lot of weakness. Then that means the body is trying to tell you the symptoms of fever through weakness. Then try to define the weakness kab lagti hai, how is the weakness and how much is the weak. For example, arsenic has weakness, muriatic acid has weakness, China Ars has weakness. But see the presenting symptom which is there in the patient. In arsenic, it is beautifully written that arsenic is a remedy where indicated for hay fever. And for hay fever, arsenic is the very important remedy where there is complete exhaustion. Complete exhaustion with great restlessness. That is arsenic. And arsenic patient, when he goes in delirium, the delirium is worst after midnight. जब भी पेशेंट हम आपके बोलते हैं रात को 12-1 बजे के बाद में जो बहुत ज़्यादा पेशेंट, मम्मी बोलेंगी द पेशेंट, आई फील एज इफ द पेशेंट डज नॉट टॉक प्रॉपरली एंड द पेशेंट इज नॉट अपने होश में नहीं है और कुछ भी बातें कर रहा है, दैट इज arsenic album, especially after midnight delirium. That is arsenic album. And of course, the thirst of arsenic, you know that the patient basically is thirsty and he drinks, sips water, that is arsenic album. So these are the symptoms that you have to remember something about arsenic album, because in arsenic album, if you miss these symptoms, you might not be able to prescribe arsenic album. Of course, then as you go further, and of course, rust oxide told you about yesterday or the last YouTube live, but there are a lot of questions only regarding fever symptoms of rust ox. Now, whenever if you want to prescribe Rustox, there are some symptoms which are very, very typical in Rustox. Of course, Rustox is a remedy for typhoid fever with its great restlessness and all. But a Rustox patient is chilly. You remember the pain of Rustox. The pain is so much that the patient feels as if the skin is scraped from the bones, but chilly. As if cold water were poured over him. That is the chilliness of Rustox. Followed by heat. And अगर पेशेंट आपको, इफ अ पेशेंट कम्स एंड टेल्स यू दैट मुझे बहुत अंगड़ाइयाँ लेने की इच्छा होती, आई लाइक स्ट्रेचिंग द लिम्स एंड आई एम बेटर, then that is a very typical and a very important symptoms of Rustox. Did you get me? Desires to inclination to stretch the limbs is a very important symptoms of Rustox fever. You know, of course, there are body aches are there, the thirst is there, the intermittent fever is there, the dry cough, the restlessness is there, but the desire to stretch, if the patient comes and tells you, you must remember Rustox. Okay, Dr. Navjot, Dr. Singh, welcome, Dr. Jyoti. So this is some symptoms of Rustox, and these are important symptoms because whenever you are prescribing Rustox, apart from the restlessness, apart from the rains, do think about these symptoms of Rustox. Now, there are some remedies which are very, very important and which are very, very, what you call, I say, acute remedies, and they are prescribed only for those acute symptoms, and sometimes not prescribed because lot of symptoms, when the patient comes to you, we give a polycrest remedy for that. The remedy which I'm talking about is Justicia Adha Toda. Now, Justicia Adha Toda, if you want to prescribe, it's a very, very important remedy, and the symptom is dry cough from the sternal region or the whole chest. The dry cough comes. That is a very important symptom of Justicia, and the cough is most of the time with sneezing and mild fever. When the patient comes to you on the first day, on the first few hours after cough, ask him. He will tell you both सूखी खांसी, dry cough from the sternal region, tightness across the chest, mild fever, cough with sneezing, again hay fever. So because what happens whenever the cough symptoms comes or sneezing comes or running nose comes and hay fever comes, we normally jump to arsenic album. But do read something about Justicia Adha Toda. Justicia is also a very, very important remedy for fever in these type of complaints. Okay, so if you have questions, I will definitely answer, but let me just complete because there was a lot of what you call queries about the fever, and that's why I had to complete that. Next remedy that you have to think about in these conditions, you know, of course, very close, you should think about Natramur also. In Natramur, the patient will come and tell you the sweats on every exertion. Whenever the patient comes and tells you there is so weakness, and whenever I start getting up, I do some exertion, I have sweating. So sweating on every exertion is a very important symptom of Natramur fever. Dr. Yadav, welcome, he's on Instagram. Then the chilliness of Natramur is also important. Coldness of the whole body and continuous chilliness is very marked in Natramur, and the time of chilliness is between, as we all know, 9 to 11 a.m. This is again a very, very important symptom of Natramur. Sometimes because what happens, Natramur is not thought of because of the chilliness. We think about a very, very important remedy that you should think, that is Eupatorium perfolatum. Now, see, if you open Eupatorium perfolatum and it is said that the patient can't drink enough water because he knows that the chill is coming. Now, this is a very, very important, of course, this is a very important symptom of Eupatorium perfolatum. He says he knows that the chill is coming because he cannot drink enough. These are the very important symptom of Eupatorium perfolatum. But let me tell you what I have seen in my clinical practice for Eupatorium perfolatum, that Perspiration relieves all the symptoms except headache. The patient catches the headache. Sir, everything is good except the head. I have severe headache, severe throbbing headache, and I cannot open my eyes also. The headache is so severe. Just give me something to relieve the headache. Now, whenever this type of symptom comes to you, we normally first think about belladonna. Of course, belladonna is very important, but just ask the patient something about fever. It is called as a breakbone fever, and about the perspiration. And immediately the patient tells you, whenever I perspire, I feel much better, except the head symptom, and it is a symptom of Eupatorium perfulatum. Welcome, Dr. Valeria Glory. She's from Instagram. Hello, Dr. Indrajit. And there is a time, I told you Natramur is 9 to 11 and Eupatorium perflutum is chill between 7 to 9 a.m. So it is said when Eupatorium ends, Natramur starts. Chill between 7 to 9 a.m. In Natramur it is 9 to 11 a.m. And in Eupatorium puff it is preceded with thirst and great soreness and aching in the bones. See, soreness and pain is also there in Rustox. But see the differentiation feature of the fever of Eupatorium perfulatum, soreness and aching of the bones. Because when the patient touches and the patient tells you, I am a lot of pain, there's a lot of soreness, and we immediately then start thinking something about arnica. Arnica also has great soreness, but always I tell you, give some time to the patient. If you give some time to the patient, automatically the remedy will come in front of you. If you just prescribe on one or two symptoms, so soreness, the patient tells, and immediately you jump on the remedies, you will only relieve it symptomatically. So in order to understand the case, just give few minutes to the patient and the remedy will come out. Good afternoon, Dr. Arora. So I was telling you something about Arnica montana. Now, Arnica montana again is a very, very important remedy for fever, and I know that elements from everybody knows that Arnica montana has it's a remedy for injury, and whenever the injury is there, Arnica montana is there. But there are some symptoms of Arnica. Simple mathematics, if you open and if you see Alan's keynote also, Arnica is a remedy which had a lot of soreness. But now describe that soreness, even the touch, the bed feels too hard, that is Arnica montana. And of course, the fever of Arnica, as you see the Arnica, the patient, it is widely said that whenever you want to prescribe for Arnica, it is said that Arnica also has shivering over the whole body. There is a lot of shivering over the whole body, and that is also a symptom of Arnica, and Arnica, like Rustox, is also very closely related to typhoid. But this shivering is so important in Arnica. And one symptom which I have seen in many of patients, heat and redness of the head. Why I am telling the symptom? Because whenever the word redness comes, the heat comes and headache comes, we immediately jump to belladonna. But heat, redness with coldness of rest of the body or coolness of rest of the body, that is Arnica montana. I hope you understand something about the fever, because a lot of cases will come to you. Dr. Al-Maghi, welcome. He's on Instagram. Dr. Munira, welcome. She's on Instagram. Dr. Bilkis is on Instagram. So did you understand something about the fever of Arnica? Shivering in the whole body, heat and redness of the head, and the whole body is cold or coolness of the body. This is a very, very important and 3-marking symptom of Arnica montana. Just give me one few minutes so that I can complete this, because still now I am getting something on my Skype and WhatsApp about the fevers. So let us go immediately. One remedy, if I don't say that immediately, the whole therapeutics will not be completed. And the remedy which I am talking about is, of course, natrum sulph. You cannot forget natrum sulph if there is a lot of dampness, and when there is dampness, do think about natrum sulph. Now in natrum sulph, first symptom, of course, in natrum sulph, of course, elements from is so important, elements from dampness and all, that is important. But natrum sulph fever. Now when fever of natrum sulph, if you're prescribing, there are 2 or 3 symptoms of natrum sulph that you have to look in that patient. And the first symptom of natrum sulph is the respiration. A natrum sulph patient comes to you with a lot of dyspnea during the damp weather. As I always tell you, look at the presenting symptom which the patient has come to you for. Sometimes the patient comes with simple cough, dry cough. Sometimes the patient comes to you with a lot of weakness. Sometimes the patient will come with presenting symptoms of lot of cough. Sometimes the patient comes to you with the presenting symptom of lot of headache, and so much is the headache, throbbing headache like belladonna. Natrum sulph, if you want to give, the patient comes to you with fever and the cough symptoms important, dyspnea during damp weather, and the patient holds the chest when coughing. Now, why I'm telling you this? Because whenever a person comes to you and he says that hold the chest while coughing, immediately we have remedies, Bryonia alba. We think about Bryonia alba. But natrum sulph also is a very important remedy. Just one symptom which will differentiate natrum sulph from Bryonia or other remedies. A natrum sulph, when he sits in front of you, he'll respire like this. There is constant desire to take deep and long breath. That is a very, very identifying feature of natrum sulph. Of course, then you have other symptoms. The patient holds the painful side on coughing like bryonia. But these symptoms of natrum sulph is very important. I hope it is already half an hour past and I'm just telling you something about the cough and all. But as I say that there were a lot of queries. So there were a lot of queries before today YouTube live. So I had to complete that first before I basically wanted to answer some of your questions. So is it okay with the fever or some more remedies? Of course, say there are lots of remedies. We can go in belladonna, we can think aconite, we can think a lot of other remedies, but these are basic remedies that you should keep in mind whenever you are prescribing for the therapeutics of fever, especially in these type of climates. I hope you got some idea about the remedies. Okay. So we have I can take some questions. The first question: if patient came with starting pain in the throat, yes, after which fever starts along with sneezing, after subsiding all the above symptoms, dry cough starts. Now see, it is so important. As I told the presenting symptom, I think Dr. Navjot got it absolutely right. One of the presenting symptoms could also be throat. So whenever there is pain in the throat, the patient comes to you. Just remember 3 or 4 symptoms. Patient से पूछिए how is the pain in the throat. The patient says there is बस irritation, खरखर से दुखता है. मतलब when I speak, it appears very simple pain in the throat with fever. Think from getting wet or from cold weather. Patient बोलता है when I drink tea, गरम चाय पीता हूँ, when I drink tea I feel better. Then the remedy is Hipar sulph. Immediately the patient comes and tells you there is a lot of dryness and बोलने पे भी ऐसी बहुत दुखता है, it pains, and that pains, it refers to the whole chest. But when I sip water, normal water also, I get relief. Then caustica. One patient comes and tells you that my tonsils are hurting because of the throat pain and that pain goes in the ear. Phytoleka. One patient comes and tells you whenever I'm swallowing, मैं थूक भी गिटकता हूँ, मेरे को बहुत, it pains too much. Okay. And then you must think about mercury, Moxol. Okay. So these are 4 or 5 remedies which are very, very closely knitted. Of course, then we have remedies where the patient says, I just have to I have to just block the throat so that the air does not touch, because if that touches, there's a lot of cough starts and the remedy becomes Rumex. And the patient comes and tells you, I have to just, मेरे को throat को सहलाना पड़ता है, means मुझे throat पे ऐसा करना है and I feel better. That remedy is phosphorus. And a patient comes and tells you, I feel there is a lot of rawness in the throat and the cough starts from there only. Then the patient is actually telling you argentum nitricum at the bifurcation of trachea. So these are the various permutation combination that you have to understand in case where the entry point or when the defining symptom of the patient is the cough point. Okay. I hope you understand something about that, doctor. And if you say that after that the cough is remaining after everything is cured, the dry cough is there, then you should think about sorinum, you should think about antium crude, you should think about one remedy is that spongia, where after everything also the cough remains, then you should think about 3 remedies. I hope you understood something. Yes, okay. So, see, there are again some rare remedies also. If I want to tell you something, of a rare remedy, it just came to my mind. Just listen to the remedy. When the patient comes and tells you that doctor साहब मुझे खांसी शुरू होती है from midnight until morning, it is coughing, and I don't feel better in the whole night, and it is aggravated from cold and all. You think about a very rare remedy, Sausaria Lappa. Saucer Lappa also is a very important remedy that you should think about, and also one remedy that is Lycopodium, where the patient says that the cough starts after midnight. But if you have never used Saucer Lappa, you must read Saucer Lappa, and it is a very important remedy. It is a plant which is basically procured from the Himalayas. So that cold weather, that dampness, everything is there in that. So in acute, if you are basically not getting the results, do think about Saucer Lappa. See, Dr. Sheikh, I'm basically telling you something in relation to Mater Medica, where I have seen clinically in my practice. See, rubric wise, there are if you see rubric wise, there are lot of rubrics and lot of remedies covered. So once I tell you a rubric, okay, I'll tell you some rubrics also. But what will happen then? In that rubric, there are about 15-20 remedies, and then you get confused what to take. This is just whatever clinically I have seen in my practice, which I'm basically sharing with you. See, your Mater Medica also has to be good. If your Mater Medica is good, automatically some symptoms are very so precise, so classical in written in remedies, that immediately you can get the symptoms. But still, if you basically want some rubrics, for example, I'll give you an example. The patient comes and tells you that whenever I have fever, my body becomes hot. So you can take a simple rubric, burning heat, and whatever the patient prescribed. But when is the burning heat? It is in the morning, in the night, in the forenoon, and for example, I'll tell you one case where the patient had lot of heat, but the patient says, one time I feel heat more, after a few minutes I get chilliness. Then again I feel heat, then again I feel chilliness. Now this symptom, basically there are two remedies which are very important in this case. The first remedy that you should think about is Laurocerasis. Of course, Laurocerasis is not a remedy which is widely used, but it has a typical symptom: burning heat alternating with chilliness. So you can think about two remedies, either Laurocerasis or simple Belladonna also. So these are the remedies where you can see the rubric. But see, in those cases again, your Mater Medica is very important. Then you think about the remedies, Belladonna, how is there, or you can have burning heat. The patient has a lot of burning heat, and the patient comes and tells you that the burning heat is basically after midnight. So you have to divide this heat part: before midnight, after midnight. If you say after midnight, the remedies becomes arsenic, the remedies become ignitia, the remedies become lycopodium, phosphorus, sulfur, or thuja also. Then you have before midnight, you can have bryonia, you can have chamomilla, you can have pulsatilla, you can have sepia, you can have arsenic also, but arsenic is more indicated after midnight. So these basically are things which you have to understand, and then you have to prescribe. Okay, so there are a lot of rubrics. Once we get to rubrics, then you will not be able to get the symptoms of the remedy. That's why I told you the difference between natrum sulph also holds the chest while coughing, and bryonia also holds the chest while coughing. But natrum sulph basically has the desire to take long breath, which bryonia does not have, because if it takes long breath, there is pain in the stitching pain in the lungs. So these are the basic difference that you have to understand. Okay. Yeah, just give me some water. No, just water. Yeah, so once Saucer Lappa. Yeah, Saucer Lappa is basically, Dr. Sama, a very rare remedy. And what happens, you must read this remedy. It is basically Ayurvedic remedy, and it has been potentized with good symptoms. I have just one question on my WhatsApp also. I'll just see that question first. Yeah, so everybody is asking about Saucer Lappa. Now, see, Saucer Lappa basically, this was a Ayurvedic medicine, potentized, and from the Himalayas. So the symptoms are basically very close to these type of coughs like natrum sulf or arsenic or hepar sulf. So it is there in Sauceralapa. The patient coughs after midnight with lot of aggravation, cold air, everything cold, cough is dry, it hurts the chest. Basic symptoms of Sauceralapa like this, which I have used in my remedies. I'll basically give you something more about Sauceralapa, but there are a lot of other questions which I'll just complete. Just let me drink some water first. Yeah. Books to understand rubrics. Dr. Singh, again, a very, very interesting question. And these questions have been asked so many times in my. I'm doing offline lectures also now and offline seminars I'm doing. And this is a question which is asked by everyone. And I have seen that there in lots of WhatsApp group and lot of Facebook groups, and also every day one rubric comes that abrupt meaning definition. It is very easy to understand the definition of the rubric from the dictionary, but how that rubric has to be taken from case taking is very important. Understand just the material meaning of the rubric, and getting that rubric out from the patient's case taking is really an art. Okay. So I would really suggest that whenever you are taking a case, you take the whole case. Of course, every time when you take a case, you cannot get all the rubrics at one time. Go home and see the life situation and then see how the rubric comes. I would suggest just case taking and understanding the rubrics through patient's life is important, because all the authors, if you see the old and the new ones, basically have tried to describe the rubrics from the dictionary, have added something about themselves to make it a bit different from others, added few of their knowledge, and then the books have been printed. But what difficulty the students get, what I see in my seminars, that they know the meaning of abandon or theorizing or building castles in air or anxiety, anxiousness, but they don't know exactly what the patient is speaking in front of us. That is the problem. So understand the rubric from the situation of case taking, what the patient has presented in front of you. That is my humble request. That is how I have understood the repertory and understood understanding rubrics. But my suggestion would be also read Mater Medica, because if you know Mater Medica, what is given where, it becomes very easy for you to get to the remedy. Okay. Sauceralapa, you can use 30 potency and you can repeat that for 2 or 3 days. There is no problem. I use 30 potency. Drowsy during fever. No, see, whenever the patient comes and tells you that he feels very drowsy, now don't just basically understand that by feeling very drowsy or feeling like that. But drowsy means, first of all, in relation to fever, if the fever is very high, if the fever is so high that the patient cannot open the eyes, the patient has gone into delirium. So there are a lot of other things. So whenever there is a word drowsy, you have to think 2 or 3 remedies which are very, very important, and they are basically first remedy. Of course, first remedy that you must think about is gelsemium. A patient drowsy, lot of prostration, and cannot open the eyes, you must think first about these remedies. Second, the remedy that you should think about is camphor. Again, the chilliness. The third remedy that you should think about is veratrum album. And one remedy, that you should think about when there is complete drowsiness, there is absolutely chilliness, the body is totally cold. Lots of people think about carbovage, but just go and read Tabacum. It's a fantastic remedy. I know that Tabacum might not be used in your practice, but Tabacum is a fantastic remedy. If you understand Tabacum, go just open. If you have Allen's just read Tabacum. Just open Tabacum, which is Tabacum. It's such an important remedy. It has a typical wordings which we want. Icy coldness of the surface with cold sweat, so drowsy, thanda pad gaya patient pura. That is Tabacum. If you have Allen's open Tabacum. Lot of nausea and faintness, and the patient is better by open air. This is a very, very important symptom of Tabacum. If you have it, just see it. It is written complete prostration of the entire muscular system. And whenever there is prostration of muscular system, we think about gelsemia. But this is tobacco. So do think about tobacco in these conditions. It's a veratramal, tobacco, camphor, gelsemium. Very, very important remedies in your mater medica. Not used so frequently, but try to get the symptoms and you will get the results very fast, That's something about tobacco. If you have Allen skin or if you have boric also, you can go. That symptom basically is there in tobacco. Of course, in veratrum, then there is cold perspiration, and the perspiration is very big on the forehead. It is like मतलब बड़े बड़े पसीने रहते हैं. That is veratrum album. Some questions have been scrolled up, so if you can write the questions again, and one remedy with tobacco you must think about is the Indian tobacco, that is Lobelia inflata. Lobelia inflata also has the same symptom, but in relation to gastric complaints, there's a lot of faintness, there is a lot of weakness. It is said in Lobelia that is an indescribable sensation at the epigastrium because of excessive use of tobacco. But it is not only in relation to tobacco, but there are a lot of other symptoms of tobacco, like there is vomiting and the face is bathed with cold sweat. That is tobacco. Profuse salivation. That is tobacco. Profuse sweat, nausea, and marked prostration also is Lobelia inflata. So very close remedies, and you should go and definitely read Lobelia inflata also. A very important symptom of Lobelia in relation to sacrum. Now you must have read Aesculus hydrastis for backache, but extreme sensitiveness of the sacrum, it is so sensitive that the patient cannot bear the slightest touch. Even the touch of soft pillow is unbearable to the patient, and the patient, that's why, sits leaning forward. ऐसे बैठता है patient to avoid the contact with the clothes also. That is Lobelia inflata. What is the difference clinically, as we say? What is the difference clinically, as we say? Yeah, I have a question that's why. So I have a question on my WhatsApp that how you differentiate Aesculus and hydrastis. So I'm just telling that only. We have some doctors on Instagram, Dr. Harshal, Dr. Rangari, welcome. Dr. Yeah. Okay, so clinically, whenever the patient comes in your chamber, your camera is on, you see a patient with backache, he's with a lot of backache and he's trying to find out place to sit because he cannot stand, the backache is so severe, he has to sit down, Aesculus hypocastinum. But when a sitting patient wants to enter your chamber, he puts both his hands on the floor and tries to get up, and there is a lot of backache. Because of that, he has to take the support and get up. Hydrastis. So these are the clinical differences you have to understand. Minor clinical difference when the patient is walking, talking, or getting up. Then you have to, even that, seeing that also, you can prescribe the remedy. So hydrastis, canadensis, Aesculus hypocastinum, and this Lobelia inflata. See the minute difference, and you will be able to prescribe the remedy. Welcome, Dr. Angari. So did you understand something about backache? There was one question on the WhatsApp, so I just took that question. Yeah. Yes, so you have understood that. Did you understand the finer differences? Those differences are very, very important to understand. Okay. So let us go further. Few questions. I might have scrolled up. Sorcerer Lappa. Yeah, Dr. Babel. I'll tell you something about Sorcerer Lappa in our maybe bi-monthly meetings. Okay. Books to understand. Okay. Potency during. Okay. So any other questions, or I can continue? I don't want to continue about mathematical because when I start, if we keep comparing and the link is lost about the question answer sessions, So one more question there is on the WhatsApp. Make a video on the repetition of remedy. Okay, I will make the video. I think I just made one of the. I think I find it very beautiful. I think I made a video on lycopodium, or I don't know, last video on the skin or cuffs. Yeah, cuff symptoms of lycopodium, and I have recently cured I've seen a lot of patients of lycopodium, and I've just made that symptoms, noted that symptoms, and If you get time, just check the part 1 video of Lycopodium cough. Polycrest remedies, there are a lot of symptoms, uncommon symptoms which basically we do not read, or we have not been taught, because these remedies are taught in a different way. The themes are there, the mental symptoms are there. That's why if you see the Lycopodium on my YouTube channel, I hope you understand that YouTube channel and get some results by understanding that video of cough in your practice. That is important, of Lycopodium. So just go and check, and I'll make a video on the repetition of potency, which I will do it. Okay. Can we have some more questions? Yeah, in Instagram, a case of seborrheic dermatitis. Dr. Indrajit. Yeah, I will discuss Dr. Indrajit. I have not seen my WhatsApp chat. I was not there. So give me some time. So let's have one more question. But do go home and read these remedies, Dr. Navjot, of lobelia and tabacum and veratrum, Aesculus, hydrastis. Very, very keen and very, very minor differentiation of backache. There are so many remedies for backache, but then if you go home and read these type of remedies of minor differentiation, you'll enjoy your practice. That's why I'm telling you the minor differentiation. So let us go further. Any other questions, or all question answered? Yes. So today the speed of the question is very slow. Maybe my speed of answering is very fast. That's also possible. The reverse is also possible. Why I'm telling you something about hydrastis, because normally I have had there's one question on Instagram. Just let me read. I started having backache while getting up in the morning. Severe backache, can't take turn and get up. Once I get up, I start walking. I get relief. Surgery. I pass motion for every stool. I pass motion after every meal. Now see, whenever you have a symptom, whenever you pass motion from every meal, then you have to understand whether you are suffering from irritable bowel syndrome, whether maybe because of some errors in diet, like lot of protein in diet. Normally patients have that problem that they go to. So if it is IBS, then it is very important to understand why IBS, and because of recurrent motion also, that can cause pain in the back, because a lot of muscles are used, the ligaments get tired, and that's why you get this type of symptoms. So that's also important to understand first. So Dr. Trivedi says no source indication. And Dr. Trivedi, I have taken one video on the YouTube, I think 2 or 3 weeks back, on no source. So just check that video, that live video I have given. If you get that video, do read that video. And still, if you find some problem, then you can get back to me. I'll answer that question. Dr. Rachel says, would you please spell the remedy that is connected with hydrastis, Aesculus? Lobelia inflata. Lobelia, L-O-B-E-L-I-A, inflata, and F-L-A-T-A. Lobelia inflata. Dr. Trivedi says in hypothyroidism. Yeah, see, in hypothyroidism, if you must use, it's a sarcode basically, thyroidinum. So I use in hypothyroid, if I had to use thyroidinum in case of sarcode, in case of hypothyroid cases, I use that especially as an intercurrent. Of course, if the constitution matches, that adipose tissue more and perspiration and the fat tissues more and other symptoms of thyroidism, I give thyroidinum. But basically, in case of hypothyroid, I use thyroidinum as an intercurrent remedy. No, Aesculus backache has no. If you have basically meals followed by stool, that means you're using a lot of back muscles for that. So it might be because of that ligamental problem or muscular weakness. Also, you can get backache. So if it is IBS, do take the whole case and then prescribe the remedy. Okay. In Aesculus, it is basically because of portal congestion. Okay. So as we go for yeah. So hydrastis. Why I was telling you hydrastis, hydrastis is a remedy which is basically taught everywhere for conditions in affection of liver. But if you open Mater Medica, it is beautifully written in hydrastis. There's dull, heavy and dragging pain. मतलब patient बोलता है कि there is a dull pain in my back and there is lot of stiffness. There is lot of stiffness and and is particularly across the lumbar region. It is written so beautifully in a mathematica, especially Bodic mathematica. The patient must use the arms in raising himself from the seat. See the line what the patient has written, the Boric has written. Must use the arms in raising himself from the seat, and that is hydrastis. No, don't use Aeschylus, Dr. Indra. Aeschylus basically has a lot of portal congestion. You have a problem with that meals followed by stools. So it can be IBS. So if you have IBS, it's basically irritation here. So take that some because of weakness also. Then you have to think about remedies like bryonia, muriatic acid, guaiacum, rustox also. So it has to be a perfect case. Except no symptom and this symptom, then you can prescribe these remedies. You know? So yeah, so I hope you guys got some differentiation. So that's why I was telling you that these type of pains, the patient must use the hands from himself from the seat, is hydrastis. I hope you got it, and please keep asking questions fast because today the speed of asking question is slow and my answer is fast. I think that's Dr. Skama. AP scleritis after sitting too much in AC leading to blocked nose, especially in left side. Now see a simple case, if there is a simple, just take one thing, obstruction in the nose. And the patient, what the patient is telling us? That by using the AC. So now exactly AC you might not have in your mathematica or books. Maybe at that time we did not have AC. So you can say after every cold. After every cold, the patient is exposed to cold, then the patient basically has that stuffed or obstructed nose. You can think about remedies like silicia also and rustox also. Simple. But if the patient comes and tells you that whenever he is in the cold weather, whenever there is raining, there is a lot of cold weather and the nose is totally blocked. Few remedies are very, very important that you have to consider, especially apical scleritis. And the remedies are, the first remedy that you should think about is definitely for me, it would be Teucrium marum verum, the first remedy. The second one you have to think about is, do write down, silicia. The third remedy that comes to my mind that you have to use in this cases are phosphorus, lycopodium. Very, very important remedy. In fact, if you have never given Teucrium marum verum, it's a very, very important remedy in cases where there is a lot of obstruction of nose. In Teucrium, there are few symptoms which are very, very important to know and understand. Just if you open Teucrium verum and if you just open symptoms of Teucrium verum in relation to nose, so first symptom it is written that chronic catarrh and discharge of large irregular clinkers is Teucrium. And whenever the patient has coryza and the nostrils are stopped up, that is Teucrium. Both the anterior and the posterior nostrils are totally blocked, and because of that there is foul breath. Patient comes and tells you there is a lot of foul breath from the nose and I feel as if something is crawling in the nostrils. Something कुछ कीड़े चल रहे हैं, कुछ चीटियां चल रही है, somebody is crawling in nostrils, then you have to think about Teucrium marum verum. Why I am telling you Teucrium? Because Teucrium mostly it is used for worm condition. But this also is a very important condition, Teucrium marum verum. I was just giving you one example. Costochondritis after COVID, pain in left chest, better from lying on left side and can't breathe fully. Warm weather and also damp weather aggravates. Of course, see, after COVID, for me, if you ask this case today, basically, you have to give first COVID-19 6 potency, 1 or 2 doses and see the results. If you don't have that nosode, you basically have to prescribe them symptomatically. You have written that in damp weather it aggravates, in warm weather and damp it aggravates. So whenever we are talking about damp weather, there are 3-4 remedies that immediately should come to your mind. Natrum sulph, Dulcamara, Entim tart, Aurum triphyllum, arsenic iode. These are the very important remedies basically for these type of complaints. And the patient cannot breathe fully. he feels the chest has been constricted, cannot breathe the chest. There is no inflation and of the chest totally. Do think about a very, very rare remedy, and that is Trichinium phos. So these 5-6 remedy, go home and read in your Mater Medica, and some remedy would definitely match. Yes, so immediately I have one answer on the WhatsApp. That's Trichinium phos. I've already discussed in my previous, I think. If you have given the nose word, I hope the nose word is properly made. That's important. Then you have to think about remedies like this: natrum sulf, antimtat, arsenic iode, aurum triphyllum, and Strychnine phos. Can we have some more questions? I hope you got something about that, Dr. Rachel. See, after COVID, there are so many cases. In fact, there are so many cases post-COVID. There are lot of symptoms. There are a lot of cases of fibrosis. I had a recent case where the patient came to me with a lot of fibrosis of lung, difficulty in breathing also. And within a month, mark my words, within a month, he is much better. He can walk 2 kilometers without getting breathless. Of course, I have not repeated that scan, but in the first dose only, the remedy has worked. My assistant doctor had taken the case, and she also knows the remedy that we had given, and it is working wonderfully. So, in cases of post-COVID fibrosis of lungs, homeopathy has good results. Do keep taking the whole case and give the remedy. You will get definitely good results. If you can't get sometimes you cannot get the symptoms, so you can just take a very generalized symptom, that constriction and tightness of chest. If there is constriction and tightness of that, then you have very large variety of remedies coming in front of you. You can think about sternum metallicum, you can think about senega, you can think about phosphorus, you can think about silicia. In fact, you can think also about chelidonium, carbon sulf, bromium, bryonia. Then define that constriction. How is the constriction? More in the morning, more in the evening, more in the night, particular part of the lung, upper, lower, middle. In that describe that, and automatically the remedy will come in front of you. Okay. Don't write the questions on WhatsApp, so it becomes very difficult for me to see the WhatsApp also, to see the Instagram also, to see the YouTube also. Yeah. So I hope you got the answer. Dr. Rachel, you are from which part of India or out of India? It is, it's already 3:57. So we have, okay, I started 5 minutes late. So just shoot few questions so that I also get something to know, No questions? That means everybody has understood. You are from UK, okay. Okay, Dr. Banerjee, okay. Yeah, so Dr. Vishaka, okay. So the basically what the patient is much better, Dr. Vishaka, but it's only 1 month, and he just followed with 1 month, and he is very, very much better. If my assistants are there on the YouTube on this YouTube live, they will also give some inputs, but he's better, but it is not totally cured because I have not repeated that scan. So let me cure that case first, and I'll definitely get back to you. And I've only given single dose and not repeated after that. Okay, so good results in fibrosis. We are also learning something new in homeopathy, because we didn't have a lot of cases of fibrosis, but post-COVID we have a lot of cases of lung fibrosis. I have a lot of cases of avascular necrosis of femur also. A lot of cases. First the cases were very sporadic. Now every month 2 or 3 cases. I have a lot of cases of migraine coming after COVID. I have a lot of cases, in fact, of ulcerative colitis and irritable bowel syndrome post-COVID. So the cases have really jumped up after COVID infections. And let me be very frank that I have got very good results in cases of ulcerative colitis and irritable bowel syndrome. The patient which could not drink milk or could not eat food, or outside food they have started eating within 1 or 2 months of a treatment. So it has given me very good results. So there are a lot of post-COVID complications, long COVID, that we are now facing, and homeopathy has a lot to offer. Just keep upgrading your knowledge clinically. I am again specifying clinically. See, I can start Mater Medica classes and I can give you that this is the symptoms of this remedy, but that you already know. Clinically, if you see something which is very out of the box and you have heard that symptom, that becomes very important. Stachinin phos, I use 30 potency. Elements from vaccination also as from COVID. I did not get the question, Dr. Webb. Elements from vaccination also as from COVID. Yes, we can. Yeah, I've got the question. Post COVID vaccinations also, we are getting a lot of symptoms. So that's also a very good suggestion, Dr. Weber. That's also we're getting a lot of cases. But treating ulcerative colitis and IBS, where other modern science have actually very few remedies to offer and very few symptoms. Basically, they put the patient on mesacolamine or steroids. Homeopathy has fantastic scope in treating these cases, and we definitely get results so fast, provided your case taking and your approach should be good. And I'm blessed with good doctors, colleagues who are assisting me in my practice, and they take good cases and all. If you also get time, you can come visit my clinic and see I can show you some good results. So whenever you get time, you are on YouTube. If you're there in Nagpur or out of Nagpur also, you come to the clinic and I'll teach you something clinically, which I teach to my students. If you take the case, you repertorize, we give the remedy. It's very clinical. So everything is transparent. So we give the remedy and see how the results. So if you get time, do visit my clinic and I'll be happy to teach you in my clinic also. So one question from Dr. Vishaka Katoch. Remedies where kids get high fever suddenly with mild cold symptoms, even leading to congestion. Yeah, Dr. Vishaka, very nice questions. And recently I had case. I had a case of a very I think he was 3 years old, and the mother came and told me, sir, till morning he was fine, and suddenly at 2 o'clock he got fever 101. And the skin is very hot to 102, and the skin is very hot to touch, and there is no symptom apart from that. So I just gave one remedy, Aconite 1 m in water, 1 spoon every 10 minutes, and in half an hour the patient called me that after giving a medicine, the child slept, and now he gets up and he wants something to eat. So that's my just experience just 3 days before. In sudden fevers, do think about Aconite, a very important remedy. Of course, second remedy that you should think about is Ferrum phos. Third remedy to think about is Belladonna. In Ferrum phos, I would like to tell you that I have got very good results in Ferrum phos when I use LM potency in repetition. Repeating every half hourly 3 doses, and the patient is out of the fever if the symptoms correspond. So these 3 remedies are very, very important in sudden fevers, Dr. Vishaka. Dr. Kalamdesh. Sorry if I am not able to read your name properly. Welcome. Do you give COVID-19 nosode in post-COVID complications? In post-COVID complication, when I feel that exactly the patient is narrating that because of a lot of COVID vaccination or this, the patient has given rise to this type of symptoms, I do start with a nosode so that it opens up the case, and then I prescribe the remedy, the constitutional remedy. I had a very interesting case in my Bombay clinic. The patient was from Dubai. The patient came from Dubai, a child of 13 years of age, developed type 1 diabetes after this COVID vaccination, and he was on insulin taking 20 units and 17 units. After the first month of treatment, the patient is still in Bombay. In 15 days, the units from 20 and 17 came down to 1 and 1. Now he is taking only 1 unit of insulin in the morning and night. Only 1. That is the miraculous results of homeopathy, in post-COVID cases. He is still taking 1 unit of insulin. And when I visit the Bombay clinic on next month, I hope that we are able to stop insulin and put him on tablets and gradually taper off the tablets also. So this is what I have seen when you open up the case with the COVID-19 nosode. of course, which I have made for myself. I am very sure that when you open up the case, automatically the constitution gives some symptoms which defines the constitution, and the remedy works wonderfully. So next question, yeah, Dr. Vishal, Bangalore, obliged for your invitation. Thank you for replying. Yeah, my pleasure, Dr. Vishal. See, I enjoy teaching, so it's no issues. You can definitely come and see the results by yourself. So is it done for today? It's already, I think, 4 or 5. I hope most of the questions are answered, and there are no questions now left on my phone and my Instagram or the YouTube. So thank you all doctors for joining. I hope you had a good time as I had time teaching you. Thank you so much.